morning, grade 9s. I hope you guys are well, and I thought today what we could do is just a lesson on the board like this where you can see me. I've missed you guys so much, and I hope you guys are enjoying the lessons away while we are in lockdown. But let's get into today's lesson. So today's lesson, what we're going to be looking at is health issues related to the respiratory system. This is the end of this specific topic, looking at health issues, and this is on page 73 of your textbook. So if you just get your textbook, okay, on page 73, you can see there that it's diseases associated. If I can ask you guys to please copy this table into your workbooks, and then you're going to write the definitions using the PowerPoint in your workbooks, please. Okay, guys, so let's get started with this specific topic. Very relevant topic considering the times that we are currently living in. Okay, so first off, the first disease that we have is hay fever. Hay fever is caused by an allergic reaction to pollen or dust. The mucous membranes of the eyes and the nose start to react and they become infected. They cause a runny nose and watery eyes. So what happens is your body is trying to flush out this pollen or this dust, and so it waters to get rid of it. Okay, the second one is a fairly common condition called asthma. Asthma is characterized by attacks of spasms in the bronchi of the lungs. So if we remember our structure of our lungs, we have that central tube which is called the trachea. The trachea then branches off into the bronchi. It's there that those tubes, the bronchi and the bronchioles, actually spasm. They tighten up and it prevents air from moving freely in the system. Okay? So the airways of the lungs swell and they narrow, so it becomes difficult to breathe. So that's what asthma is. And so asthma prevents you from being able to take air in. Okay? It's caused by inflammation of the air passages or an allergic reaction, and it can be brought on by heightened activity. So if somebody is running and those tubes start to swell, they start to become inflamed, and it can be quite difficult for somebody that is suffering from asthma. It causes wheezing, shortness of breath, and the chest tightly closes, so that tightness in the chest and coughing, inability to breathe. And how they treat this is using a bronchodilator. Broncho, talking about the bronchi, so bronchodilator, dilating, opening those tubules. Okay, next is pneumonia. Okay, so pneumonia is inflammation of the lungs caused by a bacterial or viral infection. It results in a buildup of fluid. And so what happens is your body is responding to this bacteria or this virus, and it starts to build fluid in order to try and flush it out. But that fluid then lines on the lungs, and because it's lining on the lungs, it prevents gases exchange. So in the alveoli, in the lungs, that's where we have gases exchange happening. So oxygen moving into the blood, carbon dioxide moving out. That's gases exchange. And if that is prevented by this fluid, it causes inability to breathe efficiently. That's what pneumonia is. Okay. Next disease is bronchitis. Bronchitis is inflammation or swelling of the bronchial tubes. So pneumonia, grade 9s, is in the lung tissue, in the alveoli, that last structure that we spoke about when we spoke of structures. So that's inflammation of the lungs. This is inflammation of the bronchial tubes. So there you can see bronchitis, infection of the bronchi. You have a breathless air and oxygen. So you breathe less air and oxygen into the lungs, and you experience shortness of breath. So it's inflammation, it swells, and you're unable to breathe. Okay. Sinusitis. Sinuses, these are your sinuses, the nasal passages. This is where we have inflammation of these mucous membranes over here. Okay. It causes, the inflammation of the mucous membranes that line the sinuses, it causes a blockage of the nasal passages and can result in a sore throat. So what happens is we get a buildup of fluid and gunk and mucus and stuff, and that tends to drip down the back of the throat. And when that happens, you get a sore throat. It's referred to as a post-nasal drip. Very unpleasant, and you may need some kind of antibiotics depending on if it's caused by a virus or bacteria, or your body has to just work it out. Then we have emphysema. Emphysema is usually caused by smoking or the intake of toxins into your system. It can be caused by pollutants, okay? So anything that you take into your body is going to cause the air sacs, the alveoli in the lungs, to become damaged and enlarged. So what happens is those air sacs can't expand properly, and the tissue is damaged, and therefore you can't actually breathe properly, and so it causes breathlessness and ultimately will result in death if you get emphysema. And so smoking is the major leading cause of emphysema. All right. Then the common cold. Grade 9s, most of us have had a common cold. It's caused by a virus called rhinitis, or the rhinovirus. Rhino meaning your nose, okay? So it's common cold is a viral infection of the upper airways, results in a blocked nose, sore throat, and generally feeling lethargic, feeling flat and tired. So lethargy is tiredness, sore muscles, aches and pains. All of that is associated with the common cold. Most of us have had a common cold. And then lastly, grade 9s, we can have something called laryngitis. Remember, laryngitis, this is inflammation of the voice box. The voice box is called the larynx, okay? Your larynx is here. If you put your hand just on your throat and you sing a little song, okay? Remember when I taught it, la 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 larynx, larynx. That can have inflammation, you get an infection over here. And what it causes is the inability to speak loudly, and the throat is hoarse and sore, and you might need some kind of antibiotics to treat that. Okay, so guys, those are the health issues associated with the respiratory system. You need to copy those this information. I will send this PowerPoint with the notes, and you guys can copy this down into a table, into your workbook, please. Oh, and the last one that is not in your textbooks, okay, that I would like you to copy down, in addition to the ones that the textbook has given you, is also lung cancer. Okay, so lung cancer is a disease where the epithelial cells, don't get freaked out, epithelial cells are just cells that line the tissue. They grow uncontrollably. So the cells in the lung, they start to grow uncontrollably. Now that can be in the lung tissue itself, or it can be in the trachea, in the bronchial, so you get a growth. And so what happens is the cells start to grow uncontrollably, forming a mass known as a tumor. Lung cancer is one of the most common cancers, okay? Outside of skin cancer. So skin cancer is the most common cancer across the board. Second to that is lung cancer. It's found especially in men above the age of 50 who smoke or live in a polluted area. What happens is those pollutants, the smoke and those pollutants that we breathe in, stimulate the cells to make new cells. You want to replace those cells because the smoke and those pollutants damage those cells. And so when we replace those cells continually, we potentially get to have a situation where the cells start to grow uncontrollably and cause that tumor. Symptoms include coughing, shortness of breath, chest pain, and fatigue. Fatigue, once again, being exceptionally tired. In some cases, blood can be coughed up and a fever could occur. And so those are the diseases associated with the respiratory system. Okay. For homework, guys, we finished this topic. The respiratory system is done. And so you will see at the end of this section, there is an assessment task on page 75 and 77 of your textbooks. Please can I ask you guys to complete that assessment task, and then that's the respiratory system done. Hope you guys have enjoyed the system, and I look forward to seeing you guys back in class soon. Bye guys.